Ketamine therapy and psychotherapy, an overview. Ketamine therapy has emerged as a promising treatment for various mental health conditions, particularly depression, anxiety, PTSD, and treatment-resistant conditions. Combined with psychotherapy, ketamine therapy can enhance therapeutic outcomes by addressing both the biochemical and psychological aspects of mental health disorders. This video drills into an overview of ketamine therapy, its applications, the combination with psychotherapy, and what patients can expect. Understanding ketamine therapy. What is ketamine? Ketamine is an anesthetic drug that has been used for decades in medical settings. In lower doses, it has been found to have rapid-acting antidepressant effects, making it an effective treatment for certain mental health conditions. Mechanism of action. Ketamine works differently from traditional antidepressants. It primarily acts on the glutamate system, specifically targeting the NMDA, N-methyl D-aspartate, receptors in the brain. This action leads to a cascade of neurochemical events that promote synaptic plasticity, enhancing the brain's ability to form new connections and potentially reversing some of the structural damage caused by chronic stress and depression. Applications of ketamine therapy. Treatment-resistant depression. Depression that has not responded to at least 2 different antidepressant treatments. Ketamine can rapidly reduce depressive symptoms within hours or days, compared to weeks or months for traditional antidepressants. Anxiety disorders. Conditions treated. Generalized anxiety disorder, GAD, social anxiety disorder, SAD, and other anxiety-related conditions. Ketamine can reduce anxiety symptoms quickly, providing relief for patients who have not responded to other treatments. Post-traumatic stress disorder, PTSD. PTSD involves severe anxiety, flashbacks, and emotional distress following trauma. Ketamine can help alleviate symptoms by modulating brain circuits involved in stress and fear responses. Chronic pain management. Conditions treated. Complex regional pain syndrome, CRPS, fibromyalgia, and other chronic pain conditions. Ketamine can provide pain relief by acting on pain pathways in the nervous system. Combining ketamine therapy with psychotherapy. Rationale for combination. Enhanced effectiveness. While ketamine can rapidly reduce symptoms, psychotherapy helps address underlying psychological issues, leading to more sustained improvements. Integrated approach. Combining biochemical intervention, ketamine, with psychological support, therapy, offers a holistic approach to mental health treatment. Types of psychotherapy used. Cognitive behavioral therapy, CBT, focuses on identifying and changing negative thought patterns and behaviors. Ketamine can help reduce the intensity of symptoms, making it easier for patients to engage in CBT. Eye movement desensitization and reprocessing, EMDR, particularly useful for PTSD. Ketamine can reduce hyperarousal, allowing patients to process traumatic memories more effectively during EMDR sessions. Mindfulness-based cognitive therapy, MBCT, combines mindfulness practices with cognitive therapy. Ketamine can enhance mindfulness practices by reducing the severity of depressive or anxious thoughts. Psychoanalytic and psychodynamic therapies focus on understanding unconscious processes and past experiences. Ketamine can help patients access and process deep-seated emotional issues. The ketamine therapy process. Initial assessment. Evaluation. Comprehensive assessment by a mental health professional to determine if ketamine therapy is appropriate. Medical history. Review of the patient's medical and psychiatric history, including previous treatments and current medications. Treatment sessions. Ketamine can be administered via intravenous, IV, infusion, intramuscular injection, nasal spray, or oral tablets. IV infusion is the most common and controlled method. Sessions typically take place in a clinical setting under the supervision of healthcare professionals. Infusion sessions usually last about 40 minutes to an hour, with patients monitored for a period afterward. Integration with psychotherapy. Psychotherapy sessions can be scheduled shortly after ketamine administration, when the patient is more receptive to therapeutic interventions. Therapists help patients process their experiences during ketamine sessions, integrating insights and emotional breakthroughs into the therapy. Potential side effects and risks. Common side effects: dizziness, nausea and vomiting, dissociation, a feeling of being disconnected from reality, increased blood pressure, mild hallucinations or perceptual changes. Managing side effects. Monitoring. Patients are closely monitored during and after treatment to manage any side effects. Patients are advised to avoid driving or operating heavy machinery after a session until the effects of ketamine have fully worn off. Effectiveness and research. Clinical evidence. Numerous studies have shown the rapid antidepressant effects of ketamine, with significant reductions in symptoms for many patients. While ketamine can provide rapid relief, the effects can be transient. Ongoing research is exploring ways to sustain its benefits, such as through repeated dosing or combining with other treatments. Limitations. Not a cure-all. Ketamine is not effective for everyone, and its long-term safety and efficacy are still being studied. Ketamine therapy can be expensive and is not always covered by insurance. Ketamine therapy, particularly when combined with psychotherapy, offers a promising treatment option for individuals with treatment-resistant depression, anxiety, PTSD, and chronic pain. By addressing both the biochemical and psychological aspects of these conditions, this integrated approach can provide rapid and sustained relief for many patients. As with any treatment, it is essential to consult with healthcare professionals to determine the best course of action based on individual needs and circumstances. If considering ketamine therapy, ensure it is administered by qualified professionals in a controlled and supportive environment. If you received value from this video, please like, subscribe and comment.